days is on the rise. What kind of cancers are common in children, and what kind of symptoms should one look out for?
Yes, cancers are on the rise, and the common cancer that you see in children are basically blood cancers. You have a lot many children who have leukemias, and then you have children with lymphomas, which are malignancies or cancers of the defense mechanism, defense system of our body called lymphatic. Then you have solid organ tumors also. You have kidney tumor, you have brain tumors, and there are several other cancers which are seen amongst children. But the commonest, I would say, is blood cancers, and these cancer would by and large a child would present with this fever. Then they would take a toll on their bleeding factors, and they would bleed here and there. They would have spots on the body. They would get repeated infection. They feel weak. They have bone pains. But commonest presentation in cancer in children is fever, which is undiagnosed, high fever, or bleeding tendency, or appearance of black spots, or bleeding in the skin, gum bleeding, and bone pains. These, I would say, are common manifestation of cancers of especially blood, which are pretty common in children. Of course, apart from this blood cancer, there are other areas where cancer can begin, and it would generally, the symptoms would depend on where the cancer. Say, for example, if a child develops cancer of kidney, it would interfere with. It takes a long time before the cancer, really interferes with the kidney function, and the child manifests. So it may just come as some lump in the tummy, or there could be some passage of blood in urine. So any unusual symptoms that parents should be aware of and immediately consult a doctor. Otherwise, it would fever, abnormal rash, weakness, bleeding, some lump here and there. These are the unusual symptoms. These would say alarm the parents and should consult a doctor. But at the same time, these are manifestations of cancers in children, but they are also seen in many other illnesses. So please do not equate with these symptoms with cancer, and don't get worried about that. So a child has fever and some bleeding tendency, that does not necessarily mean cancer. There are several other conditions. But yes, if you have this kind of symptom, you must go and consult your doctor as soon as possible.